Good evening and welcome to the NDTV Dialogues, a dialogue of ideas, different perspectives on key issues that seem to have disappeared from our political and media discourse. Tonight in the NDTV Dialogues, we look at why India's healthcare is in critical condition. Joining me tonight, Dr. Srinath Reddy, Kiran Mazumdar Shaw, Dr. Binayak and Dr. Ashok, Seth. Thank you all for coming in tonight. Dr. Reddy, I think everyone agrees that our health parameters are amongst the worst in the world right now. In fact, a child born in India today has less chance of survival than in Nepal or Bangladesh. How do we look at addressing even just this aspect going forward?
Well, it's true that we have had an increase in our life expectancy from the time of independence from 35 years to now 65 years plus. But even this is very unevenly distributed. The life expectancy in Madhya Pradesh is 56 years, whereas in Kerala it is 74 years. And a girl baby born in Madhya Pradesh is 6 times more likely to die before her first birthday as compared to a girl baby born in Kerala. When you look at multiple health indicators, there is huge inequity within the country, but certainly in comparison with other countries in our immediate neighborhood, of course Sri Lanka is way ahead of us, but even in comparison with Nepal and Bangladesh, and in comparison indeed with some of the sub-Saharan African countries, we are lagging far behind in terms of our health indicators. We need to do a lot more in order to ensure, firstly, that the living conditions in which our people will build up their health and not have their health threatened are improved, because health lies beyond health care. But when they do fall ill, or even for preventive and promotive services, we need the services to have outreach, efficiency and an equity perspective. And if all three are deficient, then we are going to have serious problems in terms of our health indicators, which will also affect our development, because we have a huge human resource loss because of untimely death and disability. And keeping in mind that our growth in the population over the next 2 decades is going to be in the 15 to 59 year segment, if we do not invest adequately in our human resources, we are never going to harness them for development. And even aside from that, health is a human right, and we have to treat it as a right of every individual citizen. And therefore, it's absolutely imperative, whether it is child health or maternal health or even elderly care, we need to look at health as an important attribute that we must ensure and protect across the entire life course.
Ms. Shaw, the right to health, this comes, of course, we talk about the 66 years after independence. It seems almost, I don't know whether tragicomic or how you would describe it. But the fact is that it comes in the context of where is the debate over rights, because we talk about the right to food, the right to education, and there's been a furor about when we talk about giving rights, is this about elections around the corner? What about the delivery system? If we haven't been able to do this in 66 years, do we need to change our whole method of delivery, the method of thinking, or have we actually left a large part of India behind in this whole obsession with growth, as some would say?
Well, I think, what we are really looking at is how do you build a viable, sustainable model that provides access to every citizen in terms of delivering a decent quality of health care. And as Srinath said, it's not just about health care, it's about just creating a healthy environment. So for instance, when you talk about public health, sanitation plays such an important role in health care. Now, if you look at it, 50% of our population defecates in the open, and we need to address that. So I think, building, toilets for our people is a very important part of public health. Now, when you look at how are we going to address right to healthcare, certainly I think it is a right. I think we cannot let our people fend for themselves when they fall ill, certainly not the poor. And today, as we know, 80% of healthcare spend happens out of pocket. How can we sustain such a model? Today, the whole debate in the US is about Obamacare, because they also clearly recognize you cannot exclude people in society to fend for themselves at times of illness. And we know in our country that rural illness and rural indebtedness are directly linked. So we can't allow this. So we have to develop a proper sustainable economic model that does provide health care to all. That is the essence of health care. Now, it is a challenging, it is a big challenge for the country, because it is a huge economic burden. And how do you then sustain this financial burden in terms of delivering good health care? So it does start with, preventive health care. It does entail, one of the things is we've got a lot of ingredients to develop a good universal health care model. Because when you look at intervention in terms of healthcare delivery, it's about drugs, and we are the world's lowest cost producer of generic drugs. So that is a good, starting point for us. Then we do have, a large number of primary healthcare centers already set up, although they are not all efficiently functioning, but that is good infrastructure to start with. We do have tertiary care structures, but then we are not connecting the primary healthcare structure system with the tertiary healthcare system adequately. So that's where technology comes in. How do we use telemedicine to really connect them? And telemedicine today is possible with just a handheld device, a tablet. And you don't have to have a dedicated room or something. You can actually, a doctor sitting anywhere can communicate with another doctor in a tertiary care hospital very effectively. So how do we create this whole ecosystem? What is the insurance model? So the reimbursement model. What is the drug, essential drugs is something which we've all been talking about. That has been set up very effectively in certain aspects. And one of the important things is healthcare is not just something that happens through a union policy. It is to be delivered at the state level. So states also get involved in health delivery.
Dr. Sen, as somebody who's actually spent his professional career in areas of Chhattisgarh, dealing with children there, when we talk about issues of primary health care, etc., often we talk about it from an academic perspective. You've actually been there, seen how it actually functions on the ground. What do you think needs to actually change the most? Is it about sending more funds? We've had even the President of India saying that the ratio of GDP in health spending must rise. Is it about a change in mindset? When we talk about healthcare or policy, do we look too often at healthcare for the rich? What actually needs to change?
Well, the Committee on the Social Determinants of Health, I think Dr. Srinath Reddy already mentioned this, talked about equity and said that inequity is killing people on a grand scale. That is absolutely true for India. Inequity is killing people on a grand scale. Before we come to healthcare, when we are talking about health, we have to look at the fact that there are large subsets of the Indian population which are permanently existing in a chronic stable famine, That malnutrition is existing constantly, not only among children but also among adults. In children, among all the deaths that occur below the age of 5 years, half of all the deaths are associated with associated with malnutrition in some way or the other. So half of all the deaths that occur among children below 5 years have to do with malnutrition. In adults, if you look at the proportion of the population according to the National Nutrition Monitoring Bureau, the proportion of the population that exists below a body mass index of 18.5, which is commonly held to be indicative of chronic malnutrition. If you look at the tribal areas, more than 40% of the men and 49% of the women have a body mass index below 18.5. Overall, the Indian population, Indian adult population, 36% of the total Indian adult population have a body mass index below 18.5. World Health Organization says that any community in which 40% of the people have a body mass index below 18.5 should be regarded as a community in famine. By that criterion, large sections of the Indian population are living in a state of famine, chronically living in a state of famine. Now that has important consequences for the entire healthcare system, because, for instance, if you look at the number of deaths occurring from tuberculosis annually, the number of deaths occurring due to tuberculosis has gone up 5 times in 10 years. Okay. Now this is something that has very bad portents for the future of the Indian population. I think my colleagues are trying to do that, but the point is that we are not able to make sufficient as allocations. I think that the idea that we do not have the Planning Commission has reneged on the commitment to the recommendations of its own committee, high level expert group, which for universalization of healthcare, because on the grounds that we didn't, headed by Dr. Reddy, which on the grounds that we didn't have enough resources. That's a useless argument, because we are giving tax breaks of 5 lakh crore rupees. We are giving non-performing assets into the corporate sector to the scale of, and we can't afford healthcare for to go from 1% of the GDP to 3% of the GDP. This is ridiculous.
No, in fact, I'll come back to Kiran Shaw on that, because I think this whole fighting something about what to GDP, how much spending we should raise where. But what I wanted to ask Dr. Ashok Seth, because that point raised just now, is that of course that 80% of healthcare now comes from the private system. Yet we talk about public-private partnership in this area, but there is some level of disconnect, and activists would say it's almost an obscene disconnect when you have breakthroughs in the field of, say, cancer, breakthroughs in the field of the most complex surgeries in the world. Yet the number of people who are dying of tuberculosis, the fact that over 200 children will die of encephalitis in badly staffed hospitals with no, not even basic facilities. Yet for dengue here or an issue, or even if it's a hand, foot, mouth disease, there'll be much more of an outcry, whether it's in national media or whether it's in the resources of our doctors. How do you reconcile this?
You see, they are not mutually exclusive. And I think that we want to understand this very clearly. Let me just give you my perspective of this before we move forwards. Even when I was in medical school, you'd be surprised to know that at that time we were taught, this is 35 years ago, that one Australia was getting added to India every year. And we therefore developed into a nation of 1.2 billion. So we start looking bad on every parameter of healthcare delivery, whether you call it doctor per 10,000 patients or bed per 1,000 patients, just because we have this. And we look the worst in terms of emerging economies, even including Brazil and so on, so forth. But the real issue is that this universal healthcare for all is a lovely byline, it's a lovely motto. But I always start thinking that when 80% of our population lives in the villages, at least not in the urban areas, then sanitation, hygiene, food, proper water supply is all that is required to upgrade the health, so that they don't even come to the health status issues, and that is not being provided. So let alone our whole discussion on numerous issues about this byline of universal healthcare for all, because then we talk about it's not just universal, it has to be quality healthcare for all. It's got to be value medicine for all, and that is far away from what we visualize. There are numerous hurdles in its way. Coming to the role, private and public is a much bigger issue, and I'll tell you why I say they're not mutually exclusive. If you understand healthcare delivery in this country, and now I'm talking about healthcare, not health of the country, which I think the government should be taking care of. Food, sanitation, and Dr. Seth as well just worse this, that even if we upgraded those basic amenities to our poor in the villages, we would upgrade health. But when we come to the single fact that while 70% of the population lives in villages and there are only 30% beds there, and there is 70% of beds available to 30% of the population in this country, we're looking at private being a partner to what is provided, a healthcare provider in this country. When we think that only 1.5% GDP came from the government and the remaining 4% came from the private players, when we talk about what sort of facilities exist in the public versus private hospitals, then we know
subsidized land came from public.
Yeah, in many instances, but in many instances it did not. But the same government hospitals which developed were not unfortunately able to provide numerous of those facilities where quality healthcare should come in. So when we talk about saying a district hospital which has all the government proposals to it, all the government facilities to it, is it actually providing quality healthcare? And quality healthcare is not expensive healthcare. It's a process-driven healthcare. It's an ethical healthcare. It is based on evidence-based practices, and it is auditable healthcare. And there doesn't lie in any expertise. So when we talk about a quality healthcare, unfortunately, it's one of the easiest healthcare to deliver in terms of expertise, which is moderate level of expertise, in terms of actually having processes it in terms of having evidence-based medicine, in terms of having value medicine, and value medicine is cost-efficient medicine, and that's why the patient benefits and the government benefits, and yet we don't see that existent. So I think that we can keep on discussing these two sides, but I actually find it very odd that private healthcare providers are not seen as partners, but as people who are actually fleecing the population away. And yet we must not forget that if only the trust lay between the government and the private players, we would actually create the milieu, at least one of the milieus, which could help delivery of universal health care.